people that have been diagnosed with periodontitis. If you have bleeding gums, red swollen gums, bad breath, or loose teeth, my advice, stick around for the latest edition of the Wellness Hour. Is today's topic, new treatment options for people that are suffering with gum disease. My first guest is Dr. Alice Moran. Dr. Moran is a board-certified periodontist, and she has a practice in South Orange County. Dr. Moran, welcome to the program.
It's a pleasure to be here. Thank you for having me. Discomfort.
You say this new laser has changed everything.
It's absolutely changed everything. Because the patient is not getting surgery. They can go right back to work afterwards. We either do a half mouth or a whole mouth. Typically, if I do a whole mouth, I'll sedate them so they won't go back to work.
You said they love you because, in fact, I'm quoting you. You said, well, they love me because I give them oral sedation.
Oh,
they don't even
they're
know
sedated.
they have the treatment.
I call them the next day. Not only do they not have any soreness, they don't remember anything. They feel great. Their mouth doesn't hurt. And you have to remember, Randy, a lot of the patients that I treat are dental phobics. One of the reasons they haven't come in to get their periodontal disease treated is because they're afraid of going to the dentist to go.
How many dentists nationwide, by the way, are using this new laser to treat periodontal disease instead of the surgery?
There are 700 dentists that are trained in the LANAP protocol, the laser-assisted new attachment procedure that Periolaser markets.
Okay, as of this taping.
Of today, actually as of today.
And that's what 5% of all dentists nationwide?
You know,
2%, less than that?
Yeah,
somewhere in there.
Somewhere in that ballpark. It's still fairly low.
So I understand this correctly. Okay, so somebody with periodontal disease wants to get it treated. Normally, they go to a periodontist, and you have to cut into the gums and scrape it off.
So, no, what you do actually is you make an incision between the gum tissue and the bone, you pull the gum tissue away, and then you take various ultrasonic instruments and hand instruments, and you get in there and you get all the tartar and the bacteria out of there. Then you'll also use a high-speed drill like you use to fill a cavity, and maybe smooth the bone in different areas, and then you can also do some bone grafting. Now, the laser is
So where's
different.
the stitching comes in, by the way? Because you say there's stitches.
When you're all done, you have to put the tissue back, and you put stitches in.
Put stitches. Okay. And that's the old way.
That's the old way.
But that old way is still being done today, you're saying?
It is. The majority of periodontists are still doing conventional periodontal surgery. The way the laser comes in, and I got to tell you, Randy, I was very skeptical to begin with when I first heard about this. Yes, I was very skeptical because my thinking was that you would not be able to get to certain areas. That was the thinking, that, you know, when you're doing traditional surgery, you can see very much where you're cleaning. So I couldn't really get how this whole thing worked. But the way it works is that light will get to areas that you can't even get to with traditional. The laser, the beauty of the laser is it can get to some of these areas that you can't get to with traditional surgery. And that's why we're getting such fantastic results. We're getting regeneration that we haven't even seen with traditional surgery.
You say that not all lasers are the same as well?
Yes.
Okay. So what should you look for in the laser?
What you want to look for, if your dentist has a laser, you want to know what kind of laser that is. Only the Periolaser by Millennium, and by the way, I don't get money from Millennium, I'm just giving you the information, but the Periolaser
Why do you like it?
By Millennium, because they are the only company that has done the research to back this protocol.
And it's FDA approved.
It's FDA approved, and you can see the studies in case after case where they've gotten healthy gums, regeneration, and these other lasers purport to get these results, but they really don't have the science.
So how did you get
them.
involved, by the way? Because you're treating it the other way with cutting and stitches. You go to a seminar, you hear about this.
Well, it happened on a few different fronts. I travel to some general dental offices to provide their periodontal treatment.
Okay.
It just so happens 2 of the offices that I go to, 2 of the dentists were getting involved with the Periolaser. And at first, I have to say, I didn't believe it. I kind of poo-pooed the whole thing.
You didn't like it?
No, I didn't like it at all. And so one of the dentists said to me, you know, you really have to look at this thoroughly. She gave me some of the research. She had me look at it. Well, coincidentally, I was just starting to think about it, read about it, and I was going to my perio meeting. So when I go to my perio meeting, I go ahead and I have my friends who I did my residency with, and we all talk and go to different
So the perio meeting
together.
is just...
it's an annual meeting with the American Academy of Periodontology. So
sounds like an exciting meeting, by the way.
It is.
Okay, good.
But anyway, so the last meeting, I'm with my 4 buddies, and that's all we talked about the whole week. Because
Was this new laser?
Yes, because it was the first time that they had respectable, renowned periodontist, Dr. Ray Yuckna, who's known all over the world for his periodontal research. They had him speaking about the Periolaser. He was the periodontist who helped out with their research. And so after all of my friends and I, we saw him speak, and he was talking about his experiences and said that he no longer does traditional periodontal surgery anymore.
And you said, I got to get one of these lasers?
Then between that and the reading, and though also, I was telling you about this woman who was telling me that I needed to get the Periolaser. Well, the next time I went to her office, she wanted an opinion, I think it was for an implant. Okay. On a patient. Well, this patient was one that she had done the Periolaser on. So I saw all her records, I saw the x-rays, I saw the periodontal charting, and I couldn't believe it.
You were surprised?
It was amazing.
At the results?
It was amazing.
Are you surprised now? I mean, you've been doing it for a while?
Yes, I'm really amazed.
Really?
It felt so good.
So how soon did the symptoms go away? The bleeding gums, the bad breath?
It seems to be immediate.
So your patients, I mean, immediately it goes away?
Yeah. Now, they shouldn't have any bleeding at all.
So what are their advantages? I mean, what are the clear advantages with the laser treatment over the surgery then?
Well, the biggest advantage for the patient is there's very little discomfort. Okay. They don't have to worry that they're going to be laid up for a few days, and patients love that. Nobody likes having surgery.
Yeah.
Another advantage would be no sensitivity. They don't get the root sensitivity like they do with traditional surgery. They don't lose tissue. Well, with traditional surgery, if you have a periodontal defect on a front tooth and you go in there, we can fix that defect. We can do bone grafting, we can do whatever and fix that defect. However, you're going to lose some gum tissue, and people don't like that.
So the lasers, that's behind
the laser, you don't lose the gum tissue because you're not taking anything away, you're not laying a flap. So particularly for anterior teeth, it's a huge win-win, no bleeding.
Do they give you stories? I mean, do they comment? What do they say to you? I mean, it's all done a week later. That's gone. What do they say to you? I mean, do they...
Oh, best thing that ever happened to them. It was their only hope to save their teeth. Because in their minds, a lot of them, traditional surgery was not an option. A lot of them have done that. They did it 10 or 20 years ago, and they're not going to do it again.
They swore they would never do it again.
To the details.
If this works, this laser, as well as you say, and you're involved in these periodontal meetings nationwide, can't whoever this board is stand up and say, hey, this should be the new gold standard way we do it, rather than the cutting and the stitches?
I think it'll take some time.
Will that happen?
I think that will happen. I firmly believe
the future is definitely that.
I think in the next 5 or 10 years you're going to see this starting to happen.
So dentists will watch this show because it's a dental topic. What do you want them to know about this laser? It works?
It works. Tell them to do the research, to look at the patients who have had this treatment done. You really have to see it for yourself. And if you look at the research, we record this.
This is the diagnosis part.
This is the diagnosis part. And we look at x-rays. Well, traditionally, when I was doing periosurgery, I had to, at that time, decide what teeth I was going to condemn. In other words, if a tooth is only 50-50, do I want to ask you to spend a lot of money to try to save it? Then I'm going to look bad in another year or two if we lose that tooth.
Okay.
Well, the beauty of the laser is I have a lot of these teeth that are 50-50, some that are 80-20, I think they're going to lose them. However, it's no extra work, and we haven't lost anything by going ahead and doing the laser, because we're not paying additional money for regenerative materials.
So you think you're saving teeth?
So in other words, we're saving some of these teeth that we wouldn't try to save